Welcome to a lecture on diabetes for patients by Dr. Milind Bhide. What is diabetes? Diabetes is commonly seen as a disease that will affect the blood glucose in the body. It is recognized by the fact that in diabetic patients, the blood glucose can be higher than in normal patients. It is important to remember that diabetes is a multi-system disease that can affect multiple organs, including the pancreas, the heart, the kidneys, the eyes, and the peripheral nerves. And it is very important that we understand how we can control this disease. This disease starts in the pancreas. A pancreas is an organ that is situated in the abdomen near the duodenum. The pancreas contains these islands of cells called as islets of Langerhans, which are responsible for producing hormones that are used in the control of blood glucose. What is the function of pancreas? Pancreas basically has two functions. One is digestion and the second is the control of blood glucose in the blood. As far as digestion is concerned, it will secrete certain enzymes called as trypsin, amylase and lipase, which help us in digesting the food that we eat. The food that we eat contain polysaccharides, which get converted to glucose when they get absorbed. Whenever we have a meal and the polysaccharides in the meal get absorbed, the blood glucose level will start rising. When the blood glucose level starts rising, the pancreas will secrete insulin, which will control this glucose and convert the excess glucose into glycogen. And this glycogen is stored in the liver. We do not eat all the time. We eat, say, in the morning and we have dinner in the night. During this period, when we are not actively consuming food, the blood glucose has to be maintained. And as the blood glucose level starts dropping, the pancreas will secrete another hormone, that is glucagon, which will convert glycogen in this liver to glucose, and this will help us in maintaining our blood glucose level. What are the functions of insulin? Insulin is required by every cell in the body except the brain, the red blood cells and the heart. Insulin is required for the entry of glucose into the cell. In the absence of insulin, the cells are not able to consume glucose and will rely on fats and proteins as a source of energy. So in the absence of insulin, we have a condition which is called as starvation in the middle of plenty. The blood contains large quantities of glucose. However, because of lack of insulin or because of decreased levels of insulin, the cells are not able to make use of it. And that is why a diabetic patient always craves for blood sugar, although his blood is full of it. How does diabetes develop? As it is commonly known, diabetic patients will almost always have family history. So if your grandparents or if your parents have diabetes, you have to be careful to know if you are going to develop diabetes. At a young age, everything is fine. During the initial stage, the patient has no symptoms. However, as time progresses, changes take place in the body. We tend to, generally as age progresses, our physical activity decreases. We tend to put on weight. The insulin that is produced is sometimes not sufficient for the body. This causes increase in blood glucose levels, which is also called as hyperglycemia. And because of increased blood glucose levels, patients also present with polyuria, that is increased urine formation. Many diabetic patients will also complain of delayed wound healing. So let us come to the most commonest form of diabetes, that is adult onset diabetes, also called as non-insulin dependent diabetes. It is given this name because these patients do not require insulin for treatment. Most patients can be treated by oral anti-diabetic agents. Usually presents in adult life. It is hereditary, however, no single gene has been identified which is responsible for this disease. The patient produces insulin. However, this insulin that is produced is not in sufficient quantities, and that is the reason why the patient has high blood glucose level. Besides this, there is also an element of insulin resistance, and this element of insulin resistance is common in patients who are overweight or who have a sedentary lifestyle and do not do exercise. So in a patient of adult onset diabetes who has borderline blood glucose levels, if this patient starts exercising and decreases his weight, the insulin resistance can decrease and the patient can become normal. So this is very important to remember. Which is the other type of diabetes? The other type of diabetes is insulin dependent diabetes. It is uncommon. It can happen anytime in life. It is not hereditary. And in these patients, insulin is not produced at all. So patients with insulin dependent diabetes do not produce any insulin. And they have to be treated by injectable insulin to control their blood glucose. Why is the incidence of diabetes increasing? Number one, we are living longer than what we used to live, say, 100 years back. We have a sedentary lifestyle. We do less physical activity. Our food habits are changed. We eat food which is rich in calories. Urban stress. In fact, as a country, we are facing an obesity epidemic. Let us now come to the common questions that are asked to me. I have a 35-year-old male working in a bank which will come and ask, my mother is a diabetic. Will I develop diabetes? As I mentioned before, diabetes is multifactorial. There is no single gene that has been identified. So it's not all or none phenomenon. If your parents are diabetic, doesn't mean that you will always develop diabetes. However, the incidence is higher. The predisposing factors are obesity and lack of exercise. So as a patient, if you have history of diabetes, a family history of diabetes, if you are able to maintain your weight and you do regular exercise, then you can probably delay the onset of diabetes. A non-diabetic patient will ask, I have a family history of diabetes. How often should I check my blood to see I have developed this disease? The answer is once in 3 years if you are less than 40 years of age. After the age of 40, you can do it every year. And this testing may be repeated more often if you feel that you have symptoms which are suggestive of diabetes, like increased urine formation or delayed wound healing. Another common question that is asked is, I have a diabetic relative who has a glucometer. Can I check my level there to see if I am a diabetic? Please remember that the current technology that is used in glucometers is not accurate enough to be able to correctly diagnose diabetes. This is especially true in patients who are borderline diabetic. So glucometers are not recommended for the diagnosis of new patients with diabetes. As I mentioned to you before, diabetes is a multi-organ disease. So besides the pancreas, it will also affect the heart, and it is a major risk factor for coronary artery disease, which is also called as heart attack. It also produces diabetic retinopathy, and it can also affect the capillaries in the kidney, producing diabetic nephropathy. Many diabetic patients also complain of prolonged time for healing. Whenever they get any wound, it is possible that they get repeated infections. Wound infection is a very common condition in diabetic patients, and this happens because the WBCs or the white blood cells which are concerned with the control of infection do not work well in diabetic patients. Also, the increase in blood glucose predisposes for the organisms to grow much faster and rapidly in diabetic patients than in non-diabetic patients. So infections that are seen in diabetic patients are urinary tract infection, lung infection, and other bacterial infections. Which are the investigations in diabetes? For the diagnosis of diabetes, we must do fasting and post-glucose blood sugar levels. For the control of diabetes, we can do fasting and post-lunch. We can do glycosylated hemoglobin, which gives us the average of last 3 months. We can do microalbumin, which will tell us about the functioning of the kidney. Serum creatinine is also used as a marker of renal disease. And since diabetes is also associated with increase in heart attack, it is important that we measure lipids to know what is the cholesterol of patients who are also diabetic. eGFR is a new marker which will tell us the filtration rate of the kidney in diabetic patients.